A very good morning to everyone and welcome to the Utthaan session today. So today we're starting with a new topic which is addiction. And first of all, I'd like to request everybody to please switch on their cameras and come and show their faces like Sangeeta Didi says to all angels. So the speaker for today is Dr. Sachin Parab. I'll quickly take a moment to introduce him. So, Dr. Parab is an MBBS from the Mumbai University with a specialization in clinical research. He's a senior faculty and the joint secretary of the medical wing of Raj Yoga Education and Research Foundation of the Brahmakumaris. He's a practitioner and teacher of Raj Yoga meditation since 1994. Dr. Parab has won numerous awards from the government for his services in the field of de-addiction. He is an associate facilitator for the Values in Healthcare, a spiritual approach, which is an international program since 2007. In addition to being a corporate trainer to various corporate sectors across India. He has also authored the motivational book, which is Blessings of Problems, and is a regular speaker on television for ETV Marathi and Peace of Mind channel. Dr. Parab is a professional therapeutic counselor practicing CBT and a visiting faculty of the clinical research for the MBA students at various clinical research organizations. He's also the national coordinator of My India Addiction Free campaign. Doctor, we'd like to welcome you to the Utthaan session. Om Shanti, and over to you now.
Thank you very much. I would like to show the presentation. Is the screen visible?
Yes, visible.
Okay. So, good morning, everybody. I am given the topic addiction causes and treatment. So we'll start. Any substance which, when taken, modifies person's thinking, feeling, behavior, and motor function has the capacity for addiction. Nowadays, we have added behavior also to it. Earlier, we used to say only substances causes addiction. But nowadays, we are seeing behavioral addictions like internet and video games, etc. All these substances are legal and illegal, can lead to dependence and addiction. Addiction is a disease of the brain, just like there is a disease of heart or lungs. Similarly, addiction is a disease of the brain and not a fault in character, as some people think. Addiction has got the 5 C's, we call it loss of control, then craving, compulsion, continued use despite harm. The addicts suffer from many disorders, physical diseases, even his work capacity, efficiency, relationships, everything is affected. But still that person continues to use it, and it's a chronic disease. So these are the 5 C's of addiction. In short, we can say it's a chronic relapsing disorder of brain in which there is structural and functional changes in the brain. It's a relapsing disorder. This word is very important. Many people try to stop it, but they start after some time. And many people who quit permanently, usually they do 3 or 4 times, they go into relapse and they stop. So it's a chronic relapsing disorder. That's why there is a dictum in English. They say, Once an addict is always an addict, although we don't believe it, because I have many cases in Brahmakumaris where people have quit and they have not touched it again for several years. These are the stages through which an addict goes through. Every addict starts as a using the substance. It always starts as use, then misuse, then abuse, then dependence, and last is the addiction. So people think that हम कभी कभी लेते हैं. Always remember, कभी कभी से ही addiction की तरफ जाते हैं. These are the classical stages. Till dependence, it is possible to reverse. But once the patient reaches the stage of addiction, it becomes difficult for the treating team to take him back. The success rate is very less when you reach the
Dr.
structural
Parab,
and sorry.
so sorry to interrupt, but if you're changing the slides, it is not visible.
Acha. Oh, you should have told me earlier. I thought it is visible. So what is happening then? Because I am able
Only
to see
the
it.
first slide is visible.
Now then, what has happened? Share full screen होना चाहिए क्या?
Yes, yes.
Because all participants पर share में there is no option. Anyone knows how to go for full screen option? I am getting the option of PowerPoint sharing on my laptop.
There only will be an option to share your full screen.
It is showing basic, advanced files and app, and then there are all screens visible, but full screen is not visible.
Ji Om Shanti, you'll have to do in basic and then screen share.
Basic in screen share. Screen share option is not visible. It's PowerPoint slideshow, PowerPoint, then addiction, file explorer, whiteboard. There is no option of full screen.
Once you select the file, then you'll have to do slideshow.
No, that I have done. See, I feel कि मैं ये छोटा view को ही continue करता हूँ फिर because it will waste our time.
Okay.
So this is visible now. Is this visible?
Yes,
Haan
visible.
ji, now it's
This is visible.
Visible, yes.
Okay. So this slide you are not seen, so I am taking it again. Psychoactive substance or behavior. Any substance or behavior, when it modifies the thinking, feeling, behaving, and motor function, has the ability to lead to dependence and addiction. Addiction is a disease of brain, not a fault in character as many people think. Addiction has got 5 C's, we call it. And these 5 C's are craving, loss of control, craving, compulsion, continued use despite harm, and chronic. It's a chronic relapsing disorder of the brain, which means that an addict will come to doctor again and again. This is very typical of addiction, and only few people, they are able to come out of the addiction as per the statistics. These are the stages through which an addict goes through. They always starts using the drugs, and many people think that वो कभी-कभी इस्तेमाल करते हैं. Please remember, every addiction starts as कभी-कभी, and then they start misusing, then abusing, then dependence, and then addiction. That's why it's always good not to start. Then people ask very common question, why do some people become addicted to drugs or behavior while others are not? Well, science has found out the reason for it. The reasons is in the genes. This was a study done in 3 groups All of them were given a chemical known as methylphenidate. This is a drug which stimulates the brain and it gives you a kick. So what they found out that some people found that drug pleasant, some people found it unpleasant, and some people were neutral, very few. And what they found out, those who found out it pleasant, they were the people who were prone to addiction. And later on, study found out that these people were deficient in dopamine receptors in their brain. So people who are deficient in dopamine receptors, they are prone to addiction if they start any addictive behavior or start using a substance. While those who had good dopamine receptors, their chances of going for addiction is less. So addiction has a genetic component, but there are three components which are working together. One is the genes which we get from the parents. If parents are addict, then most probably those genes goes to the children. But along with that, the environment in which the person is staying and even certain drugs. So all of these three together, they affect the brain and that leads to addiction. So even if we have a gene, suppose someone parent is addict, then if we keep our environment in control and stay away from certain addictive substances, then we will not go for it. Still, there are certain factors which protects us and certain factors which leads to addiction. So there are risk factors for addiction. Why certain children or people go for it? So in childhood, if you are engaged in alcohol or drug use at young age, you have a persistent problem behavior, you are a rebellious child, and you have a positive attitude toward alcohol and drugs. Genetic susceptibility is there. There is a conflict in the family, abuse or neglect in the family. The favorable parental attitudes or approval of substance use. If parents are using alcohol or cigarette or some other things, then most likely children will also go off. If there is a family history, if there are poor grades in the schools or lack of commitment to the school, high availability of substances in the area where you are staying, normalization of alcohol or drug use in the community, or low socioeconomic status, and family problems, all these are risk factors for children going towards addiction or even for adult for that matter. And which factors protect you? If you are a resilient individual, strong bonds with the family, school, and community, you are a spiritual, high self-esteem, and problem-solving skill. Parental involvement is there. Parent gives quality time to their children. There is opportunity for positive social involvement. Recognition is given to the person, positive behavior and achievement. Clear and consistent expectation from family, school, and community about not using alcohol and drugs. So these are the protective factors. If a person has more protective factor, then it is the tobacco, alcohol, affine, charas, ganja, and medicine. These are the addictive things. No. Now we have newer addictions we call behavioral addictions. And in those addictions, gambling, shopping, internet, mobile. My 50% lectures in school, colleges, and university, and even for adult is on mobile addiction, how to control internet and mobile. Even my current PhD, I am pursuing on this. On demand, I am doing it. Food addiction and relationship addictions in metro cities we have seen. If you have to understand the addiction, you must understand how the brain works. In our brain, there is something known as reward pathway. Nature has given us a reward pathway. We call it mesolimbic cortex. This area is known as reward pathway. And this is a judgment area. These two areas are involved in addiction. And if you can look clearly, there is an area known as limbic system, which has memories. All these three work together for the person to go into addiction. In this picture, it is shown that these are the two centers. Nucleus, this area is known as nucleus accumbens, and this is ventral tegmental area. So what happens whenever we take food or we drink or we use the drugs or physical intimacy, this area is stimulated. This area is known as brain's pleasure center, and there is a release of dopamine. But what is the difference between normal release of dopamine and when a person uses an addictive substance? The difference is when you use the food, if the number of dopamine is 10 molecules, then in drug it will be 100 molecules. So the intensity is more and person feels good. And to feel that good, the nature tells us that if anything which gives you pleasure, person tries to repeat that behavior. And this is what happens, that person falls in the trap. Initially, your brain is stimulated, but later on, it stops producing that dopamine and you will require more doses of the drug. Suppose you are taking 1 pack of alcohol and you are feeling good. After some time, you will not feel good with 1 pack. You will need 2 pack. This is known as tolerance. So this is the pleasure center which is disrupted in addicts. Second area is this PFC we call latest cortex, prefrontal cortex. This is the executive function of the brain, and this brain controls you. It controls, we call it social control or suppressing the emotional impulses. This is also defective in addicts. So both these things leads to addiction. Children are more prone to go for addiction. That's why all these industries, whether it is alcohol, tobacco or drugs, they try to catch them young, and their punchline is catch them young. It starts between 12 to 17 and the rest of the people start between 18 to 15. Very few people more than 25 years, they start addiction. So addiction is a development disease. It starts early. Now these marketing people are so intelligent, they catch them early because they are aware that children brain is not developed. It is not mature. It takes 21 years to mature the brain, and adults, they take decision from the prefrontal area, like this area, but children, they take from the emotional brain we call amygdala. So there is usually emotional hijack. The feeling brain takes over the reasoning brain. That's why children are more prone to addictive behavior, whether it is tobacco, alcohol, or nowadays electronic cigarette or drugs or mobile for that matter. Usually what we have seen is that there is a comorbidity, means there are associated diseases with addictive people. They might have mood disorder, anxiety disorder, depression, and all those social phobia, generalized anxiety. And along with tobacco, they have depression or general phobia. So they have associated disorders, and one needs to address this also because they feed on each other. There is a difference between addicted brain and non-addicted brain. You can see here in non-addicted brain, the control is very powerful and there is a strong no-go. But in addicted brain, the control is gone and saliency and memory becomes important and person is not able to control. So addicted brain, there is change in the circuit of the brain. But our message is, we always tell addiction is preventable, number one. If it happens, it is treatable. It changes the biology of the brain and the body. And if you don't treat it, it will last lifetime. People ask very common question, how long we should take the medicine? Now here's a comparison done by NIDA, that all chronic disorders, whether it is diabetes, blood pressure, or asthma, if you stop the medicine, relapse is there. Like in diabetes, 30 to 50%, hypertension, 50 to 70% will relapse. In asthma, also 50 to 70% will relapse. Similarly, addiction is a disease of the brain. Just like these are the disease of the pancreas, heart, and lungs. This is a disease of the brain. So there is a relapse. So you have to continue treatment for a longer time. Studies have shown that if a person stays sober for, if you continue treatment for 5 years, most probably you will come out of it. There are also chances that you might go back again, but chances increases 86%. So longer treatment is required. Substances are classified into 3 types: one who are depressant, one who are stimulant, and one who are hallucinogens. So after taking alcohol, opioids, or sedative hypnotics, or cannabis, you feel depressant. There are stimulant after which you don't sleep for 2 or 3 days and you feel highly elated. And there are substances after which you feel that you're flying and you get a lot of hallucinations. They are called hallucinogens. We'll see some of them. Tobacco is commonly consumed. Unfortunately, this is the biggest killer in India. I say it's the biggest enemy of the India is tobacco because it kills 13.5 lakhs people every day, every year. Every day there are 3,700 people dying because of tobacco. And we lose, as per the 2014 data, 1,04,500 crore of rupees in treating tobacco related disorders. So it is the biggest threat. Simple tobacco, gutka is causing one disease known as submucous fibrosis, very dangerous. Nowadays, people have come up with electronic cigarette. So there is no safe level of tobacco. Alcohol, there are a lot of myths available in the market about alcohol. Nowadays, this alcohol industry is so strong. It is promoting it as a tonic. It's good for heart and all those nonsense. These are unscientific things. As a doctor, I'm telling you, there is 2015 study by the International Journal in UK, which showed that there is no safe level of alcohol. Earlier, when I was in medical college, we were taught that 2 packs for male and 1 pack for female is safe. But latest studies have shown that there is no safe level of alcohol. And there is no benefit. Some doctors promote it as good for heart. It's also a myth. Especially they talk about wine is good for heart. Wine is prepared from grapes. So they say there are antioxidant in wine, but they come from grape. If I need antioxidant, I will not take alcohol. I will take grapes, vegetables, and fruit, which is full with the antioxidants. So these are all myths promoted by this industry. It's a pure chemical and it is not advisable. It is not required for living. It has no nutritional value. There are hard drugs also. Certain states in India like Punjab, Haryana, Uttarakhand, or Arunachal Pradesh. Nowadays, state like Maharashtra also. These drugs are freely available. In India, there is a lobby working which is trying to legalize ganja. Because as per them, it is freely available in certain countries. Why India is stopping it? It is very dangerous. So far, Indian government has stopped from using it. They say it's a medicine. It's a medicine if it is used in proper dosage. Definitely, there is one content known as THC, which is used as medicine, but not the way people are using it. So we don't advise it. Afim, heroin, all those powders. These are hard drugs. And the law is very strict. There is a punishment from 1 to 10 years with 1 to 2 lakhs fine. So hard drugs, latest threat is synthetic drugs, which are prepared in the labs. And this industry is so powerful. They are pushing it with different names like strawberry and chocolate flavor outside schools and colleges. So parents have to be very careful. These toffee-like things are available. They are very powerful addictive substances prepared in the labs. There are psychotropic substances. These are the medicines used by the doctors, but they also have addictive potential. So we should not use any medicine without prescription. I have many cases of painkiller addiction, cough syrup addiction, or sleeping pills addiction. So not to use any drug of allopathy without prescription. There are laws like this law, Code Pact, it controls the tobacco. As per this law came into force in 2003. As per this law, you cannot smoke in public places. You cannot advertise tobacco or tobacco products. You are seeing one advertise on television, 3 Bollywood stars who have received Padma Shri. They come like this and they say, Bolo Zuba Kesari. Now, this is the advertise of a tobacco brand, but what advertise they are showing is of elaichi, is not the tobacco. So this is surrogate advertising because they are officially not allowed to show that advertise. So they show surrogate advertise and they are selling tobacco in the market. That elaichi is not the brand, but they show the advertise of elaichi. You cannot sell below 18 years. There is a punishment of 7 years. You cannot sell it near educational institute. And there has to be photo on the pack. This is called pack. This law, JJ Act, was earlier for only psychotropic substances, but nowadays they have added tobacco to it. There is 7 years a non-bailable warrant if someone sells a tobacco products to below 18 years and 1 lakh rupee fine. Now we'll come to the treatment. What is the treatment? For treating the patients, we have to understand that all these factors are connected with each other. Physical health, psychological illness, social factors, occupational and legal. So addiction, if you have to treat, you have to use the multimodal management. The biggest challenge in addiction is relapse. Relapse is starting again the addictive substances. So there is a remission and relapse. Substance use, person goes into dependence, person stops the substance use and then again starts. So it's a vicious cycle. Many times the family members get frustrated. We have to keep patience because we know that before permanent quitting, person starts again few times. Even we have not seen this with Raj Yoga meditation. I'm going to talk about it, how meditation helps. So we have seen this slide. Substance use or addiction is like any other chronic disease, just like asthma, diabetes, and hypertension are chronic disease. Addiction is a disease of the brain. There are 3 types of treatment: medical, psychological, and social treatment for addiction. Now, what is the medical treatment? The biggest obstacle for quitting is the withdrawal symptoms. Means the person suffers from certain symptoms known as withdrawals, and you need to give treatment for withdrawals, like person doesn't get sleep, or he gets pain in the abdomen, or he might get epilepsy or convulsions. Long-term medical management, we have seen many of them have associated comorbidities we call associated psychological problem like anxiety, depression, or mood disorders. You need to manage craving and management of physical harms associated with drug abuse. Many of them are deficient in vitamins. There are various treatment available. Every treatment is different. For tobacco, it is different. For opioid or opium, it is different. For alcohol, it is different. So accordingly, we give medicines. I'm not going into detail of this. Psychological therapies, counseling or psychotherapy can be delivered individually or in group settings. So there are various types of psychological therapies: motivation, relapse prevention, or cognitive behavioral therapy, or contingency management. All these are used by the professional. I have seen good result with CBT. Of course, we give contingency management if a person fails. Support groups are also very helpful. There are the biggest support group in the world currently is AA. You must have heard about Alcohol Anonymous. Alcohol Anonymous or Narcotic Anonymous, they organize meeting in the churches, and all the people sit in circle and they share their experiences of addiction. Just by sharing, it is seen that people quit if they are regular in follow-up. Even the secret of Brahmakumaris is regular follow-up with the center. If a person goes to the Brahmakumaris center regularly without a break, then his success will increase of quitting the addiction. So these are the biggest group in the world: Alcohol Anonymous and Narcotic Anonymous. What are the principles of the treatment? Multiple treatment approaches is required. You need to combine medical, psychological, and social to give the best outcome. Single treatment is not effective. Most of the time, the parents and the family member come to us with medical treatment, but medical treatment is only part of it. No single treatment approach benefits everyone. Menu of options is required, and for good success, you have to use all the possible treatment: medical, psychological, and social. The principle we have to remember that addiction is a disease characterized by relapse and remission. Just like if you don't take tablet of hypertension or blood pressure, your BP will shoot up. Similarly, if you stop your treatment of addiction, you are going to fall back to the addictive behavior. Rates of relapse are similar to the chronic medical illness. Again and again, I'm telling you, it's a disease of the brain. Just like hypertension is the disease of the blood vessels and heart, asthma is the disease of lung. This is the disease of brain, and you need to take treatment for longer time. Relapse should be seen as part of recovery. Just like a hypertension patient may not get control with single drug or two drugs, same thing happens here. Sometimes the BP shoots up, sometimes asthma goes up. So similar things happen. Relapse should be seen as part of recovery, and it is not should be seen as a failure of recovery or treatment. Preventing and managing relapse is an integral part of substance use disorder. So should not lose patience, especially family member. Addiction is a chronic illness. Treatment required for longer duration of time, usually months and years. Only mild addiction people, they quit. And certain patients I have seen with Raj Yoga meditation. As a doctor, I fail to understand how they can stay sober. And there are patients, I have patients with 20 years, 25 years. They have quit addiction after practicing Raj Yoga. Treatment is more effective if client is made an active partner, involved in deciding treatment goals, treatment modalities, and treatment duration. The more the person participates, the more is the success rate. There are common myths associated with addiction. Number one, addicted person does not want to leave drugs. They can give up whenever they want, but they don't want to. Now, this is a myth. Many individuals with dependence, they want to quit. In India, there was a survey done, GATT survey. You can see it on the internet, Global Adult Tobacco Survey. As per that, more than 50% people want to quit, but they don't know how to. And they are not getting success. Many would have tried on their own to quit the drugs, but they are not successful. Would have relapsed. With power alone is not sufficient to quitting drugs. Only few people are able to quit, not everyone. And all those who are able to quit, probably they have good dopamine receptors in their brain. Second myth is addiction can be treated only by admitting the person for months in a rehab center. Now, this is again a myth. Most patients can be treated on outpatient basis. Some require inpatient treatment. Very few require indoor stay for longer duration. The third is counseling is the best way to treat addicted patients. Now, as I told you, addiction requires multimodal treatment. You need to combine pharmacology, psychology, and social approaches. Family and social support is also very important. I have seen patient has stopped addiction, and when he goes back again to the home, same environment, same stress, then most chances that he will fall back again. So family and social support is very important. We should not stigmatize these people. Our attitude should change from an addict to a ill person. Just like we accept a ill person, we have to accept the addict that he is having the disease of the brain. Only motivated people can be helped. Motivated people have higher chances of recovery. Even unmotivated people can be helped. Most of the time, the addicts, they don't want to quit. So family members, they come to us, and there are medicines available which can be given to them without their knowledge, just for their benefit. And afterwards, they feel good and they stop. Strategies are available which can minimize or prevent harm. Still, the person is ready or willing to give up the drug use. So we call it harm reduction strategy. Your psychiatrist will direct you. So conclusion in addiction management is addiction is a medical disorder and it's a mental health issue. Addictive disorders are chronic diseases with relapses and remission. It is just like any other non-communicable disease like heart attack, blood pressure, or asthma. Multimodal treatment is required to manage addictive disorder, supply reduction, demand reduction, and harm reduction. Medical, psychological, and social treatment is available. Willingness of clients and their involvement is crucial for better outcome of the disease. Now, what we do, it's a short acronym in 12 Ds to remember to quit addiction. First, you have to decide that you want to quit. Then you have to declare to your family and friends that you have stopped tobacco, smoking, or alcohol, so that they do not ask you. Then you have a determined thought. You delay when you get a craving, or you distract yourself. You do regular exercise, because exercise also generates the dopamine. If you practice meditation, that will also help you. Discuss in a group, just like Alcohol Anonymous or Narcotic Anonymous. If you are not able to control, then go for medicines which doctor will suggest. Then your friends, always talk to your friends or someone who supports you, can be a family member. And if by chance you derail from your goal, then don't give up, because it's a known phenomena that people before quitting completely, they have relapses 3 or 4 times. What Brahmakumaris has done in this field. This was the project My India Addiction Free India, launched by Brahmakumaris in 2013. Brahmakumaris, every center if you go, you will get few people who have quit addiction without any support, only by meditation. This project was launched by our ex-president Srimati Pratibha Tai Patel. It is running successfully all over the India. Then we launched one global initiative for tobacco awareness at our international headquarters in front of Governor of Goa, Mridula Sinha. We were also participated in international conferences where 180 people have visited our stall and saw that Raj Yoga meditation has been scientifically helped. This is the national team of tobacco. We have received various awards from the various states. I am from Mumbai. Maharashtra government has consecutively awarded us for 7 years through Mahatma Gandhi Nasha Mukti Award. Other states also, Odisha, Rajasthan, we have received the award. Recently, last year, we have signed MOU with Government of India. In fact, I should say Government of India has signed MOU with us. This is a national program, Nasha Mukt Bharat Abhiyan, of social justice and empowerment. And this is a signing of MOU which happened in Delhi. I was present there. On behalf of Brahmakumari, BK Asha Didi, who is the director of ORC Retreat Center in Delhi, signed, and is the cabinet minister and state minister of social justice. And this program is running successfully all over India. I had opportunity to present even in G20 about how Raj Yoga helps in quitting the addictions. And these are the G20 people. Even our president is going from state to launch this program. President is from Odisha, so she has launched this Addiction Free India Odisha campaign. Something about Raj Yoga meditation. This Dr. Selva Murthy, he is one of the biggest scientists of India. He had come to Brahmakumaris, and then after going there, he gave this definition of inner communion with the supreme light. It's a communion of inner light with the supreme light. That is Raj Yoga meditation. We call ourselves human being. Human has come from root word humus, and being is a life force. So one is soul and one is soil. We are aware about the soil, but we are not aware about the soul. The more you practice soul consciousness, your original qualities, they get activated. This is the mechanism you can see. We have 4 consciousness: conscious, subconscious, unconscious, and supraconscious. Ideally, this slide should be seen in full screen, but it's okay. Many people talk about the subconscious. Brahmakumari talks about the supraconscious, which are our eternal original qualities. Very powerful stage. I'll talk about the study in short, and then we'll go for question answers. We did a study in 1,000 patients of India who were from rural and urban, literate and illiterate, age group from 19 to 83. Most of them were male. They were having multiple addictions: tobacco, gutka, cigarette, alcohol, opium, that is afim, marijuana, ganja, painkiller, and sleeping pills. what we saw that people who quit addictions, they 53% had more than 5 years lifestyle of Raj Yoga. Alcohol, 37% were using sometimes in a day, 17% were using most of the times of the day. The commonest cause of addiction was peer pressure, as we have seen in earlier slides. Some people use it to reduce the stress for fun, and some people say it's a bad habit. And what we saw was very interesting. 64% people quit within 1 month of Raj Yoga meditation. And most of them quit. 97% quit fully within 5 years. So that is a very good result. Many doctors find it difficult to accept, but that is what I have seen. So advantage of Raj Yoga lifestyle. Raj Yoga is taught by Brahmakumaris. It has got all yogas in Bhakti, Gyan, Karma, Sannyas. Person from any religion, caste, age, sex can do it. It is practiced with eyes open, hence true Karma Yoga. It is scientifically proved. No specific postures or asanas required. It is worldwide. So Raj Yoga meditation as taught by Brahmakumaris is very easy method. I am in this field since last, I would say, 25 years, travel through all the states of India, and my experience is highly motivational. I have stopped many medicines and people have quit with Raj Yoga meditations. Thank you very much. Om Shanti. If you have any questions, you can ask me. The basic thing which I would like to mention here is addicts are not bad people. We have to change our attitude towards the people who are using substances or behavior. What they require is not the alcohol, cigarette, tobacco. What they require is dopamine. All of us require dopamine. Only thing is that these people have not developed the skill to get dopamine from the healthy source. See, music, exercise, meditation, all this helps in getting the dopamine. As I shared with you, Alcohol Anonymous, AA, is the biggest organization in the world who is working in the field of addiction, and they just do it by sharing with others. So even you're talking to your friends will help you in a long way. So dopamine is required, and meditation, Raj Yoga meditation has been scientifically proved to generate the dopamine. So I would suggest if any person wants to quit or wants help, he can take help from the local Raj Yoga Center of Brahmakumaris, where it includes positive thinking, also meditation, also a group support, because all of our participants, they don't go for any addiction. So healthy environment is given. Any questions? I hope I am audible.
Yes, you're audible. I think there are no questions. You can move forward.
Okay, so thank you very much for giving me opportunity. Again, I am telling you, addiction nowadays we are seeing is more of behavioral addictions. Okay, we already had a challenge of tobacco, alcohol, and drugs, but nowadays biggest challenge is mobile and internet addictions. And mechanism is same. It is the dopamine in the brain. We need to develop healthy habits, and meditation is one of the healthy habits. You can exercise or listen to the music. There are many other good coping skills which you can develop. Help is available. Addiction is totally preventable. If it happens, the treatment is available. The longer you continue the treatment, the better are the outcomes. Raj Yoga meditation has been scientifically proved to help people in quitting addictions. Only condition is that you must go to the center daily for 3 to 6 months to get the result. Because our brain circuit to change, it takes that much time. It's a chronic disease, please remember. And there are always relapses and remissions. So we should not lose hope if someone is not able to quit. If you need any help, my number is always there. You can WhatsApp me and talk to me. I thank you, Brahmakumaris, for giving me the opportunity. Thank you very much. Om Shanti.
Thank you, Dr. Parab. Thank you so much for coming to the Utthaan session and taking the session today. And thank you to everybody else for attending. Let us meet the next week. Have a nice day. Om Shanti. Thank you.
Om Shanti.